Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. And it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals, maybe people that you've never talked to before or met before. But the goal is to really help you understand how to access care when you need it. This program is really for you. So if there is something that you want to learn about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. Today we have a very special guest with us, a pharmacist, actually a PharmD, Sarah Bourgoin, and she works in the ambulatory setting at the hospital and in the pharmacy. Sarah, welcome to this episode of our show.
Thank you.
How are you doing?
So excited to be here.
We are excited to have you. I really think, in a person's life, a pharmacist is somebody that just about everybody in the world gets to meet at some point. Well, I shouldn't say the world because some places don't have pharmacies, but especially in the United States, right? Are there any kind of percentages on? There can't be anybody that never met a pharmacist, I would imagine, right?
No, I think pharmacists touch everybody at all points in their lives, yes.
Good. So tell us a little bit about yourself.
So myself, I've been a pharmacist for about 15 years now. I've worked at Bristol Hospital when I first graduated. I had a student rotation there, worked a little bit there. I worked again for a couple years, just central pharmacy there. Got a little bit involved with oncology at that pharmacy, and then left briefly for Hartford Healthcare, came back to create this clinic. When this was offered to me, I was very excited because it was an opportunity to create the clinic from the ground up. I actually created the workflows through IT, the workflow in general as far as how are we reaching out to the patients, all of my spreadsheets, all of that was me. So it was very exciting to be able to do that. I've lived in Bristol essentially my whole life, so I'm a Bristol girl through and through, so I'm very excited to be working with the community in Bristol.
That's awesome.
Yeah.
So what made you pick pharmacy? What was the attraction?
When I was in high school, I picked pharmacy because it seemed just a great job for someone to have some flexibility in their schedule. You're working weekends here and there, so you can have a day off during the week, which at the time just seemed appealing. Now I like that I don't have to work weekends, which is really nice.
So you have some other healthcare workers in the family, right?
Yes, yeah.
So.
My mom is a labor and delivery nurse. She's worked at Bristol for almost 40 years now, and she loves it. I don't think she'll ever retire. And then my sister's an APRN at Charlotte Hungerford.
So everybody in the family. It's funny. My mom was a nurse and tried to convince my sister not to be a nurse because of exactly those issues, working nights and weekends and everything else. And of course, she became a nurse. So.
Mm-hmm. Sometimes my dad doesn't like the dinner time conversations we're having. But
you know what? Healthcare is a very interesting thing to bring home to the dinner table for sure. So talk a little bit about the connection with patients and how. So you're a PharmD and you're a BCPS too. I'm not sure what that stands for.
So it's a board certified pharmacotherapy specialist.
Okay.
So that just means that specialized medications, I have a little bit of extra knowledge, a little bit of extra training. It was just an extra certification. Right now I took an exam for an ambulatory care certification, so I'm waiting to see if I have passed that. If not, I will retake that exam and I'll have those initials added to my name eventually. But ambulatory care, the reason I wanted to add that one is because it's kind of more what I'm doing now, which ambulatory care, what that really is it's a pharmacist that's embedded within a specialty clinic. That's kind of different than a hospital pharmacist because we're working with more of an outpatient setting, but it's also different than retail pharmacy because we're working with really specialized medications that require some extra education.
I often hear that, you go to this specialist, you go to this specialist, you go to this specialist. So it could be your cardiologist, your pulmonary critical care doc, could be a neurologist and others, and your primary care physician. And often what happens is, the prescription that you get or the medication you get is specific to some kind of a disease state, but you have to kind of step back sometimes and say, how are these things all interacting with each other? And quite often, you have, especially elderly people, they become unstable unstable, and they have other effects from all of these layered things. Is that part of what you do?
Yeah, exactly. And what's really nice actually opening this clinic is I've set up collaborative practice agreements with the cardiology office, the pulmonary office, the neurologists, primary care physicians as well. And I have some patients that I'm calling to do education on a new medication from that provider when I had already educated them on a medication from a different provider. So in essence, I'm their pharmacist. And I tell them when I hang up the phone, I say, I'm your pharmacist. If you have a question on any over-the-counter medication, anything you need, please call me. They have my cell phone number. I get calls, after hours sometimes, and I'll answer any questions that anyone has.
Sarah, that is really amazing. I mean, because I think it is, and if you have parents that are aging, and like I can remember going to my mom because she was a nurse. She had like the little things laid out. This is Monday. These are the 3 doses and everything else. It gets really confusing. And some of those medications, like I know my dad, every morning he would have, his blood pressure would crash, and he'd have to sit somewhere, take his blood pressure, wait, and managing all that stuff was really difficult. So having somebody like you to help support an individual is so critically important. Exactly.
And I've worked at places like CVS before, and it's really great to be out with the community and have so many people that you're seeing and filling so many prescriptions, but there isn't always that time to really sit and educate someone on the medication. There's not that time to sit with them. Whereas in the current role I'm in, I could have someone bring in their weekly med box and I could go through their meds with them if they wanted to. And what I used to do in my previous job was I would take a picture for them, and that picture they would reference every single week so they knew which pills to put in and refill every week.
Yeah, that is so important. So talk a little bit about the clinic itself and the importance to the hospital, and how that whole, because the retail pharmacy for us is relatively new. I mean, it's all happened in the last 4 years. And so the clinic is actually an evolution of a whole process that we've gone through with our pharmacy.
So with myself being the pharmacist working under a collaborative practice agreement, I can order prescriptions under those providers and send them directly to the pharmacy. And when we do that, we are able to get the 340B benefit of that medication. A lot of the 340B intricacies are a little above my knowledge, but as far as what I'm doing is I'm qualifying those prescriptions for 340B, and then that money comes back to the hospital with the thought that the money will go back into the community supporting other services.
Yeah. So, and the whole conversation about 340B is I'm still learning. I missed one checkbox that came into an email to my desk, and it cost us almost $250,000 one day. It was devastating. It was actually the first quarter, and I had thought I had got everything, and then at the last minute they threw in another question and we didn't get it. So the oversight of it is really complex. So then I took myself off of that. So now I have the people that really know how to do that stuff doing it. But in a nutshell, that the 340B discount program is actually a drug manufacturer discount program. So for a hospital like Bristol Hospital that has what is called a disproportionate share, or a high share of Medicaid patients and self-pay patients, the government has set up this program that allows us to get these discounts to help us to provide care to those that can't afford the care, or as some would say, those that have insurance plans that don't pay full cost. And there is a lot of discretion about how we can do that, how it goes back in the community. For us, it's access. It's, supporting the ER, supporting, all the specialists that take care of patients that have, insurance that doesn't pay the full bill. So, so hopefully that explains it. Yeah. But so this collaborative relationship that you have with doctors, talk about that a little bit.
So when we initially started the clinic, it's a new concept for a lot of providers. And I have to say, I've been very happy that all the providers at Bristol have been so welcoming to sign this agreement with me, because here I'm a pharmacist asking them to prescribe medications technically under their name, but it's through me. And they've just been so gracious and trusting, which is wonderful. It helps that I've had experience doing this before. But I work with those providers, and the collaborative practice agreement allows me to work at the top of my license, which is really neat as a pharmacist. We don't typically get the opportunity to prescribe medications. We can prescribe supportive care. We can order labs. And what that does is that really takes that piece off of the provider so they can work and focus more on more complex patient issues they have. They don't need to worry, did my patient ever get their Repatha? Do they have questions? They don't need to worry about that because they know that I'll be calling the patient and doing a follow-up call after they've received their first injection. So they don't need to worry if the patient's confused or missed their dose or anything like that.
Yeah, as someone who uses Repatha, I went from the syringe that I just pushed a button and it worked to now having one with the needle on the end. Seeing the needle is a little bit different than not seeing the needle.
I agree.
So I'm not sure why all that changes, but I can only imagine, for me, the first time I opened the bag, I was like, what's going on here? What your role is, those questions people would
Exactly, and I have the Repatha dummy injector pen, so I can show patients how to use it.
Is that right?
Yeah, so I can, via telehealth, or if they want to come in and come see me, I can show them how to use it for the first time.
Yeah. It's every time, because it's every 2 weeks for me, I don't know if that's the standard dosage, but I always forget where I gave myself the shot the last time. And so my wife is like, well, let's just do some indelible marker and we'll mark your legs and your stomach. And I'm like, I don't think I want to do that.
As long as there's no irritation, you don't have to go crazy figuring out the rotation.
But it is the more I process, and I work in healthcare, so I can ask the stupid questions anytime I want, or at least there are no stupid questions, but sometimes I feel that way. It is so good to have somebody that you can rely on. I've gone in after hours because we don't, we do deliver pharmacy prescriptions to your home. We have a complete service within our service area. We take care of patients that go through the emergency room. We have all these really good things for patients. But sometimes you got to get a prescription in the middle of the night, so you got to go somewhere else. Yeah. And that's an experience anymore. I had to do it the other night. It was like 9:30, 10 o'clock at night. And wow, you wait and wait and wait. And it seems like the pharmacies are staffed with one pharmacist and what do you call them? Pharmacy techs?
Pharmacy techs.
There's like 4 or 5 or 6 to 1. So, so the pathway, it's really kind of interesting. You interned at the hospital, and I have some friends that are pharmacists. Actually, my next door neighbor was a pharmacist, and there's a kind of a unique difference in the hospital setting. You talked about oncology drugs, chemotherapy, and that kind of stuff, and then the community-based pharmacists. And it's as I've kind of evolved my understanding of this, pharmacists that continue on in the hospital setting with those complex medications. Tend to stay there, and the ones that go out into the community struggle if they want to try to get back into the hospital to relearn all of that stuff. And obviously medications change every day. Yes. But you chose to pretty much stay in this really complex environment. I'm not suggesting that CVS isn't complex too, but it is really a very different and a complicated environment.
And it is stressful. I've worked at CVS, I've worked at Walgreens, and I actually help coach pharmacists on how to get into the hospital setting. There's a couple different ways to do it. Just because in a hospital it is a little bit more relaxed. You are using more of your clinical knowledge, and the CVS environment can be a little stressful, but you are having that face-to-face with patients, which I do love. So that piece, when you are working in the central pharmacy in the hospital, you do miss out on that patient interaction. So what's nice about what I'm doing now is it's the best of both worlds. I still get to interact with some of the retail setting as well as some of the hospital settings, some of those specialty medications. And I do pick up shifts occasionally in the central pharmacy as well. So I get to go right back with all the IV medications and antibiotics and all that. So.
Wow. I was just reading this week. I tend to read a lot of different things, and MD Advisor was talking about the prevalence of IV therapy clinics, hangover clinics. I mean, I know this is something you were planning to talk about, but it was actually pretty interesting to read. They're giving people IV solutions for hangovers and all these other things. and they've had quite a few complications, and they had at least one death related to that.
Yeah. A lot of those aren't necessarily regulated. There's a lot of regulations that come into play with IV medications. There's a book that I ask all my pharmacy students when I'm mentoring students, or I have students shadowing me. I tell them to read the book Kill Shot. It's actually about the Massachusetts compounding disaster, where they were having patients having medication, steroids injected, and those injections were tainted because the pharmacy was not up to par with all their cleaning standards, and a lot of patients died.
Yeah, it's interesting because in that article they talked about, there's a pharmacist, and they often compound things to enhance all kinds of things, and they aren't necessarily up to the standards, exactly what you said. But I am aware of people that do it, and I am aware that there are visiting people that actually do them in your home. So I was quite taken back by that. But so where do you do education? You've gone to the senior center you've been at the senior center doing education. What kind of questions, what are the common questions you get from people?
A lot of times patients will ask about really side effects. They're not sure if a new side effect that came out of the blue is related to their medication. Typically it's not if they've been on the medication for 10 years. So it could just be sign of something else, could be a sign of disease progression, things like that. I was at a wedding this past weekend, and my uncle came up to me with his med list, and he said, I have AFib and these are my meds. And usually when people hear I'm a pharmacist, they always just want to have me look at their med list. So I find that very touching.
At a wedding? Yes. At a family? But that's healthcare in general. So, I know, people sometimes they'll say, I looked it up and this is a complication and I think I have this complication. So the amount of information that's available now on the internet, and not always specifically reliable information, can cause you to wonder and wonder and wonder. So the key of the clinic is really to help the physician, help the providers, get the patients an extraordinary, almost an intimate kind of like, I can call you, I could talk to you, can ask my questions, and also to ensure refills happen or changes happen and things like that. How does somebody access, and you use this word here, pharmacotherapy clinic? How do they access the pharmacotherapy clinic? So after the initial referral from the provider, I reach out to them, and then they have my contact information. So from there, they can email me, they can call me, anything they need, I'm there. So I can't remember the number, but the number of prescriptions that are prescribed just in our MCC, our medical center, is something like, it's in the tens of thousands a year, I think, if I remember correctly. So how are you going to keep up with all that? Well, the goal is that, maybe there's 5-10 pharmacists in a couple years. So that would be great. So right now we're slowly growing the clinic and focusing on those high cost specialty medications. And the clinic could really go anywhere. There could be a specialized pharmacist that's just doing cardiology, and then they maybe do warfarin INR monitoring in addition to that. So there's the possibilities are endless. So I guess as I process everything that you're saying, the community-based pharmacists aren't really doing this. And the reason we're doing it is because of the special program that the federal government has created around this 340B discounts. Yes. And it enables us to do this really incredible value-added offering to the community that we serve, which is, it's extraordinary. Yeah. In fact, I'm gonna probably talk about that at the state's healthcare cabinet, because people ask all the time, like, where are those discounts going? What are you using those discounts for? But this is just an incredible example of how valuable that is to our community. So, so what's next in this progression? You say you build all the spreadsheets and algorithms. What's next is just adding more providers, primary care providers. I'm meeting with another one next week, just adding different providers to the clinic. And what's nice is the pharmacy acquired a specialty license, so they can acquire more specialty drugs. So what's funny is when I was studying for my ambulatory care exam at midnight and just looking through all the different specialty meds for certain things, I had an email drafted, and I was sending this email saying, can we get this drug? Can we get that drug? Because there's all these new drugs that I had never even heard of. They're just brand new ambulatory care specialty medications. So
I just think adding more drugs, more providers, and having that access to the community. One thing that is a rate limiting step is you need to share an EMR with the provider. So there was a provider that recently reached out to us from the Harold Lever Cancer Center that wanted to work with us. He had heard about us, but unfortunately we didn't have shared EMR and we could not access the drug. So that's something where there was that roadblock there. But eventually if we can order the drug and we can have a shared EMR, then that's somebody who we can really branch out into the community with other providers.
Yeah, I didn't realize that. It's interesting, a lot of the bigger organizations can afford the system, Epic system. And we do have a state EHR, Connie, which works effectively, but interoperability is still a problem. And for us, we couldn't possibly afford Epic, so we have Meditech, and then we also have a separate system in our medical group, which does create those kind of issues. Hopefully someday we will all be on the same system, but. And I think the government is kind of moving towards that to try to make sure and ensure that whatever system you're on, there's interoperability and there's connectivity. I do think our state's done a good job with Connie to help, because I know our ER docs can literally look through the records for any hospital, anything when somebody presents in the ER. So in terms of that, it's there, but it doesn't connect to nursing homes as 100% and some other things. But it's really an important point. So what else? What are the key things that you want to, as a pharmacist, as someone who's engaged every day, all day long, pretty much, what do you want to tell the community?
I just want to tell the community that there are pharmacists that are your best resource. We are people who are accessible. You can walk up to the counter, you can talk to us, ask us any questions that you have. One big thing is I'm big on med safety. There's hundreds of prescriptions that are leaving the pharmacies every single day. So always look at your medication, look at the bottle, know what your medication is for. If you have to have somebody write on the label what the medication is for, that would be ideal. Other things I would say would be, if you ever have pills in your bottle that look different, you can turn the bottle to the side and it'll actually have a description of the pills on your bottle. So that's one thing I always just try to promote safety.
I didn't realize that.
Yeah, and then another thing too, because this has happened before, is make sure your name is the name that's on the bottle. There's mistakes that can happen, the human error factor. So just take your own health into your own hands, know what we're treating here with those medications, and know which good questions to ask your pharmacist.
Sarah, 15 years as a pharmacist and your journey was long, and the passion you have for what you do just oozes out of you. And so don't ever lose that, because that's what it takes, I think, to provide just extraordinary care.
Thank you.
So this has been a really good episode of Bristol Health Cares. You can write us at cares@bristolhospital.org if you have any suggestions for future shows. We appreciate that. Special thanks to Nutmeg TV. They're here as a just tremendous community resource. Things that you would love to be able to see, but you can't make it in the community, and they get them on cable TV for you, so you can watch at your convenience. And they do shows like this, which are really, I think, very important to the community. And so thank you. Please support Nutmeg TV. They're a nonprofit organization. And please keep coming back to Bristol Health Cares. Until the next time, thank you. Have a wonderful day.